It's a new day at St. John's. We are working on changing our culture. We're working on changing our culture to one where patients and their families are partners in the care that we deliver. Patient and family-centered care, the patient and their family are part of the healthcare team, and we as caregivers are part of their experience. Patient and family-centered care is about including the patients and families in the care that they're receiving and in the operations of our organization. We're asking them to include their voice and their opinion and their advice in guiding how we design policy and practice at St. John's. A patient and family approach can bring the care that we provide to the next level. St. John's has 5 values, and they spell out I care: innovation, compassion, accountability, respect, and empathy. When I think about those values, it's clear that they all influence the family and patient-centered model of care. The principles of patient and family-centered care are respect and dignity for patients and their families all the time and every time, even when it's not necessarily convenient for us. Information sharing in a way that patients and their families can understand and is useful to them. Participation, patients and their families being involved in their care at the level and to the extent that they want. Collaboration, which is working together with our patients and their families to improve the care that we give to all of our patients. We're going to tell you a story today about a patient as he makes his way through the hospital system. As he goes, he's going to interact with a number of different caregivers, some of them better than others. See if you can pick out the 4 core concepts of patient and family-centered care and the 5 I care values. Also, ask yourself how his interaction with each caregiver affects his patient experience.
So sorry. Hi.
Yes, what can I do for you?
So my dad fell in the bathroom. He slipped and hit his head and his hip, and I got him here as soon as I could.
Can't he come to the desk?
Huh?
Never mind, what's his name?
Thomas Smith.
Does he have insurance?
Yes.
Oh, you know what? Hold a second. Hey, it's time for my break. Can you cover for me? I really need to go eat.
Sure. Hi, good morning. How can I help you?
So as I was telling the previous young lady, my dad slipped in the bathroom. He fell and hit his head and his hip, and I would like somebody to see him right now.
Oh, I'm so sorry to hear that. I need to get some of the information from you. I'm just going to ask him if it's okay for you to give me the information because we have to protect our patient's privacy.
Sure.
Hi. Why are you here today?
I just told that to the nurse in the triage.
Want to tell me again?
Said I just told that to the nurse in the triage. I'm in lots of pain and I need something. I need some medication now.
Okay. Well, let me see what I can do for you, all right?
Okay.
So when is the doctor going to come see him?
Ma'am, the ER is very busy right now, as you can see. Let me see what I can do, though, all right?
I don't understand.
Hello, good morning, Mr. Smith. Sorry to keep you waiting. My colleague had to go and see another patient.
Yes.
I'll be taking care of you today. I'm Angela. What would you like to be called?
Tom?
Great. Tom, could you please confirm your last name and date of birth for me, please?
My last name is Smith. Date of birth, January 9, 1948.
Thank you. Now, I know you may have told this to other people before, but if you wouldn't mind, could you please tell me what brings you to St. John's? I want to make sure that all the information I have is correct.
Yes, I was in the shower. I slipped. I hit my back, my hip, my head. And I could not get up. And that's when I called my doctor to come and take me to the hospital.
Oh, I'm sorry to hear that. Don't worry, you're in good hands. Dr. Granger will be seeing you today. His resident will come and examine you soon.
Thank you, nurse.
You are welcome. Now, if you need any coffee or anything to eat, we have the coffee shop in the lobby. And the cafeteria is in the basement. You could take any of the elevator going down to the basement.
Thank you so much.
You are welcome.
Hello.
Hello, are you my doctor?
Oh, no, I'm just the resident. What's wrong?
My father's been waiting here for a long time,
Well,
and nobody has come to see him.
well, we know this is ED. We have a lot of sick patients here. So what brought you in?
He has repeated this several times already. Don't you guys have this in a chart?
And who are you?
I'm his daughter.
You know what? Never mind. I'll examine you.
Dude, what's up? Gonna go get some coffee?
Sure.
I'll show you some.
Oh, okay. I'll see you in a sec.
All right.
So where were you again? Yes, I was examining you. So I read in the chart that you had a fall. Was it bad?
Yes, it was very bad. That's why I'm here.
Why do you think we're here?
Okay. Let me examine you. Okay. I have examined you. The attendant is gonna come and we'll go from there. Okay?
What does he mean by the attendant? Thought he was a doctor.
I don't even know. He didn't even introduce himself.
Hello, sir. How are you? Ranger. I'll be your attending physician today.
Okay, doc.
So I understand that you had a fall at home. Can you tell me a little bit more about it?
Yes, I was in the shower. I fell, I hit my head, I hit my hip, I hit my back. And I could not get up by myself, and that's when I called my daughter to come and take me to the hospital.
Okay. And this is your daughter here?
Yes, I'm the daughter.
Hi, how are you? Dr. Granger, nice to meet you.
Nice to meet you too.
I'm sorry that I've kept you waiting this long.
Yeah, I've been waiting so long. I'm in lots of pain, and I did not get any medication for my pain.
All right. I apologize for that. Let me assess you and see if there's anything I can do in the meantime to get your pain under control.
Okay, doc, thank you.
Tom, I see that you're in a lot of pain. All right. My resident will be putting in the orders for pain medication right away, and the nurse will be here shortly to give you that pain medication. In the meantime, what I'm going to do is I'm going to put you in for an X-ray of your hip, and also do a CAT scan of your head to make sure that you don't have any fractured bones or that there's not any bleeding going on in your brain.
Okay, doc.
Okay.
Thank you so
Thank
much,
No
you.
problem. Thank you. Anytime.
Hello, I'm here to take the patient to radiology.
Excuse me, what are you doing?
Are you Mr. Smith, who fell and hit his head?
Yes, I am.
Okay, we're gonna go for a CT now.
How long it gonna take? I need something to eat. Can I get something to eat first?
I don't know, hon. I'm just here to take you from point A to point B.
Hello.
Hi.
Oh, sorry for the mess. Let me get that for you. Have a nice day.
You too, thank you.
Hi, good morning, miss. Who are you waiting on?
My dad is taking a test. His name is Tom Smith.
Oh, yes, I did see him back there in the CAT scan area. My name is Stephanie. I'm one of the technicians here. Actually, it's going to be a little while, but if you like, you can wait here in the waiting area, and when he's done, I'll come get you.
Thank you.
Okay, no problem. Nice meeting you.
Same
Okay.
here.
Hello, my name is Michael.
Okay.
Are you Mr. Smith?
Yes, I am.
Okay, Mr. Smith. I'm here to take you to your floors. Can you confirm your last name and date of birth for me?
My name is Thomas Smith. Date of birth, January 9, 1948.
Thank you. Be admitted to the 10th floor. And the nurses on the floor are very kind, very friendly, and they're taking good care of you, okay?
Okay, thank you. Please don't push me too hard because I'm in lots of pain.
Absolutely.
Hi, Mr. Mr. Smith, my name is Chandra. I'm going to be your nurse.
Okay.
Okay, so I'm going to give you a little bit of orientation about your bed and about your core bell and the television and the rounding we do here at the hospital. We work until 7:30, so I'll be your nurse from now until 7:30. This is the core bell. If you need anything, please call for us. The pain, water, need to use the bathroom, everything you want. Please do not get up unless you call us. Your safety is very important.
Hello, Tom.
Hello.
I'm Dr. Williams. Pleasure to meet you.
Okay, sir.
And I heard the nurse told me that you'd like to be named Tom. Is that correct?
Certainly.
Okay, that's great. Well, I'm Dr. Williams. Nice meeting you. And I assume she's your daughter?
Yes, she is.
Elisa, right? I've heard your name is Elisa. It's a pleasure to meet you too, Elisa. This is Dr. Tercero.
Hi, nice to meet you.
She's one of my residents, so she'll be rotating with us today. We're here to do the medical rounds today, and we are here to explain you what has happened, to come up with a solid plan for your treatment, and explain you what is it exactly that we're going to be dealing with. We'll be using a lot of medical terms, and if you do have questions, we definitely encourage you to ask any of those questions. However, because we would like to do the rounds first, I would like to leave those questions at the end of the round so that you can come up with those questions. We can explain all of it in lay terms so that you understand all of it. For now, Dr. Sir, would you like to keep them updated, what has happened?
Sure. So, as you all know, he got a CT scan that showed a complete non-displaced fracture of the neck of the femur. Basically, there is no, the alignment is okay between the head and the neck of the femur, so he's not going to need any kind of surgical intervention or any kind of reduction. So that's good news. And as far as the CT scan of the head, that showed no bleeding or any fractures.
I'm sorry, Doc. I don't understand.
As you know, your father has recently fallen and has fallen on his hip. So there is a fracture of the hip bone. But luckily, the fracture is a small fracture, which is in medical term we call it non-displaced. And in fractures, when it occurs in big fractures, the bone gets dislocated. But however, in this particular fracture, the bone has not been dislocated. For fractures such as this, for small ones, we normally treat with only medically. We do not normally do surgical interventions. We try to limit your physical activity. We give you pain medicine and give you also physical therapy to get, to get the strength and to get where you were before the fall. And this is all actually good news. One other good thing that I'd like to share with you, the head CAT scan, which is a picture of the brain, did not show any bleeding or any other issues found, so that's all good news, and we'll try our best to get your recovery as soon as possible. What are your expectations about this?
How soon will I be able to walk? Because my granddaughter graduation is coming up very soon, so I would like to be there.
I understand your concern, so I will definitely try to get you there as soon as possible. Your health and your safety not to fall again is our first priority, but me and my team with Dr. Tercero will try to get you to your daughter's graduation. Remain certain that we'll try to get you for that. Okay, we'll try our best.
Yes, what do you need?
I need something for pain. I mean, lots of pain.
Well, I'm way behind right now. I have a lot of patients to see. I'll be back in a little while, okay?
Will my doctor be coming to see me?
I don't know. I don't remember seeing him.
Oh, I hope the pain does not get worse.
Yes, me too.
Mrs. Smith, hi, how you doing? And you have a lot of pain? Where is your pain?
I didn't know I hit my head, I hit my hip, so...
Oh, you fell. From the pain level of 0 to 10, what number are you at?
I'd say about 8.
Well, I'm going to go now and get you some pain medication, and then we'll take it and we'll see what happens from there, okay? I'll be right back, okay? Mrs. Smith, I'm here with the medication.
Okay,
the doctor ordered Percocet. It's 1 tablet. I'll be giving it to you now, okay?
Okay.
But before I give it to you, can you just please tell me your full name?
Thomas Smith.
And what is your date of birth?
January 9, 1948.
Wonderful. Thank you so much. Let me open up this medication for you. Here you go. And I'm going to give you some water. Very good. In 30 minutes, I'll be back to assess the pain and hopefully it works for you.
Okay, nurse.
Okay.
Thank you.
You're welcome. Anytime.
Hi, can I help you? You look lost.
Yes, my father was admitted to this floor and I don't remember which room he's in.
I remember you. You're Mr. Smith's daughter. I was here the day he was admitted.
Yes.
Father, he's such a nice man. I know that he likes the Yankees and we talk often. If you like, I can take you to his room.
Thank you so much for taking care of my father.
You're very welcome.
Yes, Mr. Smith, what do you need?
Is Sue here?
She's busy with another patient right now. Can I help you?
Well, actually, we were hoping to see Dr. Williams. Yesterday, he told my father that he'll be discharged today. Is there any way that we can see him?
Well, I don't keep Dr. Williams' schedule in my pocket. He is a very busy man and he comes in at different times, day, evening. I don't know if he'll be able to see you.
Well, can you find out?
Well, I'm very busy right now, but when I have a minute, I'll call his resident and ask him.
Okay.
Hi, how are you?
Hi, I'm good. How are you?
I'm good. Mr. Smith talked about you so much.
Oh,
so nice to see you again.
Nice to see you. He talks about you too and how well you treat him.
Thank you so much.
We were wondering if we can talk to Dr. Williams about his discharge.
Absolutely. Just give me a minute. I'm going to go out and page him and he should be with you shortly. Okay, I'll be right back. You're welcome.
We'll be discharging Mr. Smith today. I want you to prepare the discharge instructions and give them the detailed information about the discharge and the follow-up plan of care. If they have any questions, please answer those. And if you do need help, let me know. So I wanted to ask you, how was this patient care video that you recently watched, by the way?
So it was very short, but I think it was a real eye-opener. We never really think about what the patients think about us or our behavior in the hospital. So I think I learned a lot. I can teach you anything if you want.
That's very good to hear. Yes, absolutely. I'll ask you more questions about it. But let's go see more patients now.
All right, thank
Great.
you.
Let me come in.
Hello. Hey. Hi. I'm Dr. Tercero, medical resident. How are you doing today?
I feel much better.
Okay, that's great. I'm glad your daughter's here so she can join the conversation. So Dr. Williams and I, we're here today because we're going to talk about your discharge. What's the plan and what's going to happen once you get home? Okay?
Yes, I'm glad you're gonna do that because my dad will be living with me for a while and I would want to take care of him as best I can.
Well, that's actually great. It's going to be very helpful for his recovery because once he's in a familiar space, you're going to have to help him take his medications on time and he's going to need some kind of supervising while he regains his strength. Mr. Smith, did the physical therapy team come up here and teach you?
Yes, they did. They have been really helpful with my walking and balance myself.
Okay, that's good because you're going to have to continue physical therapy for about 6 weeks until you regain your strength.
Okay, will he be needing any of those little things that you walk
need
with?
a cane or a walker?
Yes.
Yes, most likely he will be needing something. Dr. Williams will write the prescription for him and then the social worker will basically arrange for him to get that. And then also physical therapy will go to your home and they're going to assess how the home is basically to reduce any fall risk while he's there and he's recovering. There's another thing that I want to go over. With Dr. Williams and I going over the chart, we saw that you take practically no medications, which is great. So where we are, we'll just give you a prescription for painkillers and some calcium supplementation.
Okay, thank you.
Okay, so we're going to give you 600 milligram of Tylenol 3 times a day. We will advise you to take this with meals to avoid upsetting your stomach lining. If the pain gets more than 8 out of 10 during the day, you may be taking the 4th one, but we would strictly advise you not to take more than 4 tablets a day because there may be some side effects. And what's important to know, you don't take those 3 tablets together once a day. You split them up 3 times a day, 1 with breakfast, 1 with lunch, and 1 with dinner.
Thank you so much. That would be. It's much easier now that I understand. Is there anything he can or cannot eat?
There is actually, this is a condition when there is really no contraindication for food per se, but we would advise you to eat a lot of food that are rich in vitamin D and calcium, such as soy milk and banana. Do you understand, Mr. Chong, about the discharge medication you'll be taking?
Yes, but can I take the medication with, can I mix it with food?
Well, typically we don't mix the medication with food, but we do want you to take it with food 3 times a day. One pill with breakfast, 1 pill with lunch, and 1 pill with dinner. Again, like I mentioned before, if your pain gets out of control, 8 out of 10 or more, do go ahead and take the 4th pill, but no more than 4 pills a day. Do you have any other questions for me?
No, not right now, except I'm very glad that this is happening. It makes it much easier for me to take care of him.
Okay, you're welcome. So again, if you have any other questions, you can ask the nurse or you can ask myself or Dr. Williams. We'd be more than glad to explain things more than once to you, just as long as there's an appropriate understanding of what the plan is and where our goals are.
Sure.
What truly heals a person? Our journey to patient and family-centered care will help to not just heal our patients' bodies, but also nurture them as people. This is beyond the medicines we give them and beyond the therapies that they're involved in. There's a connection that we all feel, that we need to be connected to something greater than ourselves. We as healthcare professionals can help that person and family understand more clearly what's happening while they're with us, what to expect, and include them as partners in their care. There would be much more successful outcomes. Successful outcomes are not just clinical. Every touch point in the patient and family's care contributes to their experience. How can you contribute to the patient and family experience? Are you the patient experience? Do you demonstrate St. John's Eye Care values? How will you include patient and family-centered care principles into your interactions with patients and their families?